Welcome to another segment of Plastic Surgery Channel Deep Dive, and we're talking about breast implants and the safety of breast implants. I've got two exceptional guests with us. We have Dr. Foad Nahai, who is the editor-in-chief of Aesthetic Surgery Journal and past president of the American Society of Plastic Surgery. And then we have Dr. Rod Rohrich, who's the editor-in-chief of Plastic and Reconstructive Surgery and the past president of the American Society of Plastic Surgeons. So Foad and Rod, being the editors-in-chiefs of the two world's greatest plastic surgery journals, I know that you have certainly some opinions and insights into this article that many people have certainly known about and criticized perhaps on some of its scientific merits. But Foad, I'd like to start with you and just get your thoughts on this Annals of Surgery article and its conclusions.
Well, I think we're all very much interested in patient safety. I think as a society, as individual practicing plastic surgeons, and definitely as journal editors, we do want to put patient safety as a priority. We do want to put valuable and reliable information out there concerning the safety and efficacy of breast implants. Having said that, I have a lot of respect for the authors, a lot of respect for their institution. And anytime somebody publishes a series of close to 100,000 patients, then we do need to look at it. We need to analyze the data. We need to see how they arrive to their conclusions. And as this is a deep dive, I would like us to both, or all three of us, to really dive deep into the data, into the validity of the conclusions, into how the data was analyzed, what were the limitations beyond those that the authors themselves acknowledge. And I commend them for acknowledging the significant limitations of their papers. So this is all in the interest of patient safety, in the interest of having evidence-based information on the safety of breast implants and whether there's any association with these rare events. With this may well be the second time that we are scrutinizing and looking at these implants with a view to checking and make sure that what we're recommending to our patients are safe.
Rod, what were your thoughts in looking at this paper?
Well, I think, Bill, thanks for having Foad and I on to talk about this. I think, it is a large post-approval study that the FDA released, last year. And I think that, as Foad mentioned, we should look at it. We should analyze the data. And I applaud, our great colleagues at MD Anderson for doing so. The challenges with all of these large post-approval studies, as all of us know from the FDA, is that it's very hard to get any real data that provides conclusive conclusions. And that's the problem here, because you have two cohorts from different manufacturers with different criteria that they looked at that really had self-reported data. And that is the biggest crux. And the other thing is that they were comparing silicone to saline. So there was no comparison data, no cohort. So out of all that, there was biased surveillance on by each vendor. And of course, all of that was pointed out, as Foad mentioned, by the authors in their limitations. So I think to try and do a broad reach on getting significant conclusions on this is really a challenge. So much of it is self-reported, not verified, and that's a challenge. And I just don't know that we can have any conclusions from this study.
Fuad, and this is called a study, but it's really more a review of two studies, because you can't really take two studies that are different and combine them and then add the patients up and say you have a patient study of 100,000 patients, right?
Correct. Two studies, one of them for 2 years, one of them for 6 years. Rod has done a very good job pointing out some of the confounders here. We know very little about the age of the patients involved. We know little about their previous history, the type of procedure they had, any pre-existing conditions that the patients may have self-reported. So there's a lot to dig into here. There's a lot to discuss here in terms of the confounders here that most likely affect the conclusions that the authors are coming to, despite their own acknowledgement of the limitations.
Yeah, I mean, Rod, you both kind of alluded to a lot of the information was collected self-reported, so with no confirmed medical diagnosis. But the issues with that for a layperson, for example, you'll see a lot of people say, "Well, I have a gluten allergy," right? But they know, and they don't really have celiac disease. They've never been tested for celiac disease, but they just feel like they have a gluten allergy. So that's a self-reported thing.
Right, and I think that's why we need to go back to the peer-reviewed literature, as I think both Foad and I are trying to point out. To date, if you look at the science of breast implants, there's no cause and effect relationship between that and cancer, between that and rheumatoid arthritis, between that and suicide, between that and breastfeeding and their children and any congenital problems. That we have good evidence-based data for. The data for some of the other things is soft, and this study does point that out, but it was with self-reported data on some of the autoimmune problems like scleroderma, Sjögren's, and all of these very rare, infrequently diagnosed problems. And so one can't make a cause and effect relationship between implants or anything else. We don't even know what causes these diseases. And of course, the far reach is fibromyalgia. Fibromyalgia is one of those diseases that you come to when nothing else fits. And so I just am perplexed that even though this is a large group of patients, that I applaud the authors for attempting to review, but it's very challenging to get any significant type of conclusions from this data.
Fuad, what do you think? Where should we go from here?
Well, I think we have called for years for a breast implant registry. I believe our colleagues in Australia and New Zealand have already started on one. I know that our two societies have been talking about a breast implant registry. I think that's how we will have the data to show exactly what the risks are of these implants, rather than these self-reported, basically retrospective reviews. Rod mentioned that we've been here before. If we look at the 1999 Institute of Medicine report showing little or no association with collagen disease, with rheumatoid, Marcia Angel writing in 1996, going through the evidence and going through the discussions and concerns that were raised in the early 90s, again, looking at hard evidence that there is very little association between the silicone breast implants and rheumatoid arthritis and other collagen vascular diseases. Right. The other area that I think we should look at is that a lot of comparisons are made with the general population, but the authors don't tell us where they looked or which source they went to, because if we look at the rate or prevalence of some of these rare conditions that they mention, there are several, if not dozens of studies in the literature actually discussing the rate of these rare events in the general population and those that have never had a breast implant. Yet the authors don't point out to us or tell us whether they went to one source, whether they went to several sources, and then came up with a consensus as to what the true incidence of these rare conditions is in the general public.
You know, Bill, Floyd, I think that's well put. I think where we going forward is that one thing we've learned is we side with the patient. We side with patient safety. And we've learned that from the ALCL. You know, all of our societies, especially ASAPs and the ASPS, have worked hard and worked together to look at this rare type of problem. But we are looking at the science. We're looking evidence-based. We're being doctors first, not plastic surgeons. And I think that's where, as plastic surgeons, we're physicians, so we're siding with the patient. So if patients have these issues, we need to listen to them. And if they want to have implants removed or want answers, we need to look to science. We can't look to emotion anymore. And we've learned that from the 90s. And we learned that science is what we must trust first, and being on the side of the patient and patient safety. And I think that's what we as board certified plastic surgeons always must do. We must stand with our patients.
Yeah, I think that's well put. And certainly I think that's why this has kind of raised so much, ire amongst the scientific community, because there are, Fuad, you mentioned it, a lot of really good, well done studies that have been done since 1992, probably culminating with the Institute of Medicine report, which is a multidisciplinary report that exhaustively looked at the safety of silicone breast implants and basically emphatically concluded that they were safe and not associated with these diseases. But this is almost like, not back to the future, but back to the 80s when, this is poor science when we already have good science. And I think it would be useful maybe for each of you just to comment on there's always room for good science and more good science, but it's not good to take something that's bad science and because then patients get the wrong message.
I agree, Bill. I mean, as both Foad and I said, we have good science. We've learned from the 90s, no link to cancer, no link to most autoimmune diseases, no link to suicide, no link to breastfeeding in their children. But we still have some areas where we need to work on, some of the rare autoimmune, the rare diseases. But I think the biggest thing is, we have a resurgence of this, the silicone implant illness type issues. And if you look at Google, there's 13 million searches when you put in silicone implant illnesses. So there is a lot of social media concern and real concern out there. And we just need to listen to our patients. And I think we have been. We've been listening to them. We've been actually taking this and actually applying what science we have to see what are the issues with any types of problems related to plastic surgery and in breast implants. So I think as plastic surgeons, we listen to our patients, we turn to science and we turn to evidence-based medicine to see how we can stay safe and make sure that what we are doing is right for the patient.
Fuad, what are your comments on that?
I agree entirely with Rod. I think patient safety first. I think looking beyond what we already have, the Institute of Medicine, Marcia Angel's work, and other series that we published in both sets of journals since then, we need to continue to search. We need to be able to look at our patients and tell them with certainty based on level 1, level 2 evidence that what we're recommending to you is safe. The other point that I would make is that, we also need to explain and we all need to understand that there's so many positives to breast implants. If we go beyond breast reconstruction and restoring the whole woman and just look at aesthetic breast surgery with implants, the increase in quality of life, the satisfaction, I think we are all aware of that, but we're showing incredible responsibility. We're putting our patients first, where we concentrate on the possibility of rare events, where we all know that on the positive side, there's great satisfaction with breast implants, there's great improvement in self-esteem and quality of life.
No, I agree. I think that, there's so many positive. There's no such thing as a perfect type of implant or a perfect anything in medicine. But, I think the biggest thing that we're doing is that we are looking at this from a scientific viewpoint and trying to put science first and patient safety first.
Yeah, I think that's some really, really incredible insights from both of you.
I think people, when you read those social media blogs, I think the biggest thing that I see is that we need to, as plastic surgeons, we need to listen to them. Because like in the 90s, one thing that we learned was that if a patient wants to have their breast implants out, that's their choice. And they just need to know that when they have them out, it's not going to change their life or change what happens, with their illness. But, if they want them out, that's fine. But we shouldn't be telling them to do things that are not safe for them. So when I look at those blogs, Foad and Bill, I see all of those things that I saw in the 90s about how we didn't listen to the patients, that we don't care. And I think that is not true. Board certified plastic surgeons, we care. But we also need to make sure they make an informed choice, on whether they should take them out or not. And I think in the 90s, people made an uninformed choice because it was the hysteria around implants. Today, the difference is we have science to show that, most of the things that they're concerned about really actually are okay. No cancer, no significant problems with some autoimmune diseases. And we just need to tell them that. And I think if we do that, we're going to be fine.
That's a great point. And Foad, I'm sure you agree.
I agree. Our job, our commitment to our patients is to provide them accurate and reliable information, answer their questions, listen to their concerns, and then have them make an informed consent. And once they've made that decision, then we respect that decision. We're not going to talk them into keeping their implants or talk them into removing the implants. As long as we provide accurate, evidence-based information discussing the risks and the positive aspects of breast implants, positive aspects of keeping them, possible negative aspects on body image of removing them, we should allow the patients to make that decision, and whatever that decision is, we respect it and we'll take care of it.
Yeah, I fully agree too. We through Plastic Surgery Channel have interfaced with an ALCL and Women with Breast Implants Facebook, and we actually have an upcoming program with some of them, and they're very intelligent, very well spoken, and it's been great to develop that relationship and really hear some of their side of the story and some of the concerns and some of the other things now that we're collaborating with them on and trying to research that entity more. So it really has been a very beneficial relationship. So that's, I think, well said by both of you.
Yeah, Bill, I applaud you for doing that. And I think, we certainly did that a lot in the 90s with some of our breast implant patients in the 2000s. And I think, we can certainly do that again. I think it's important that we get that feedback so we know we're on the right track.
Well, I also, I want to conclude by just also applauding both of you because, you lead, the two leading plastic surgery journals in the world, and you do, I know it's a thankless job, but you both do an incredible job. You have two great journals, and, we as plastic surgeons, we rely on both of you to kind of lead that because that's how we advance, evidence-based advancement of our craft. So thanks so much for all you do, and thank you very much for being on this deep dive.
Our pleasure, Bill. Thank you. Thanks for what you're doing. This is very important.
Yeah. Thank you very much, Bill. As always, Rod, it's great to have the discussion together.
Likewise.